This information is for educational purposes only, does not constitute legal advice, and does not create an attorney-client relationship. If you need legal assistance about a legal problem, contact an attorney. Welcome to Healthcare Pros Charting Texas, where we break down your healthcare license risks and regulations in just a few minutes. I'm Simone Murphy, and this is your Friday Focus brought to you by Know Your Regulator. Today, I'm joined by Maggie Ortiz, a nurse advocate, former Board of Nursing investigator, and someone who's seen firsthand how social media can put your nursing license at risk. She's here to walk us through what every nurse and healthcare professional needs to know before they post online. You've got a pretty unique background as a former, nursing board investigator. What is the first thing that would trigger, the Board of Nursing's interest in a case like this?
More likely than not, it's going to be someone sending in this video. So it would roll onto the investigator's desk in some form of a link to a video in an email, or because traditionally I would get a folder and have to open up the folder. But like you said, in the evolving day and age, for the investigator as well, that would more likely than not be a link to a video, whatever platform. It doesn't matter whether it's LinkedIn or TikTok or Instagram, or it doesn't matter where this is generating from. You're just video on your own phone. It's just not appropriate at all. It's the epitome of unprofessional conduct.
Yeah.
For so many reasons. I think that I would hope that not just the nurses, but anyone who holds a professional license, and unfortunately seems to be prevalent in the last few years amongst the nursing population. But this is a cultural poor practice, and we never do that. So the Board of Nursing most certainly would be looking at that, the HIPAA, the privacy violations, the policy violations, because it's considered a theft of time as well. If you're going live on any of these platforms, more likely than not, you're making some money as well. So now you're double dipping while you also have a badge on, hold a professional license, recording at your job while you're doing your job. And it may be people take for granted that it will be a verbal name that is possibly said. We write names, or there could be abbreviations of names, and people like, that's not a big deal, but it is, because people can place you at your job and Sally Sue your neighbor at the job the same time that you were there, and all of a sudden their name is on a board, and then there's a diagnosis in the background, and they can put those two letters together with when you were working, and then when they, do you see what I mean?
Oh, yeah.
Go down a bad rabbit hole.
A separate kind of trend going on is when someone feels wronged, or, consumer feels wrong, they kind of post it, and they've got these, people who are able to dig up all this information. I think it's incredibly naive to think that people who are watching this video or are on the internet who see this type of content wouldn't be able to do that same type of research.
I also have to say, as someone who's been practicing for 25 years, I'm very proud of my profession, and that is not upholding the integrity of our profession. And what's the message we're giving to patients as well when we do stuff like that? No, we don't need that light on us, especially now. It's the epitome of unprofessional conduct. Because I also like to remind nurses, swing that door the other way, take your badge off and lay in the bed. Would you be okay with them TikToking you out, or Instagramming or Facebooking live out while you're just at your job, and all of a sudden you're plastered all over? Remember, it's a privilege to hold a license, and that's the board's words, not mine. And that can be taken away from you. That privilege has far-reaching ramifications if that lands on a desk at the Board of Nursing. You and I both know that very well.
Yeah, absolutely. So it's, really clear the public kind of plays a big role in how this can get escalated. Let's kind of dig into exactly what's going on here and how it crosses that line. That wraps up this Healthcare Pros Charting Texas Spotlight. If you'd like more, you can follow Know Your Regulator wherever you listen, and be sure to subscribe to our social media so you can receive those weekly Friday clips just for healthcare professionals.
Know Your Regulator, the podcast that inspires you to engage.